Nice to be here. I always appreciate being invited into our monthly wellness webinars. So thank you for being here too. As Matthew just said, we're talking about brain health and cognitive function. I'm not going too deep into any details. I'm kind of doing an overview. So as you can see on screen here, hopefully some of the takeaways are going to be gaining a clearer understanding of some of the key nutrients and foods that can support our brain health and cognitive function, some of the other lifestyle factors that we always include in these discussions as well. And then the last thing too is about some strategies and resources for not just your own brain health, but maybe you're working with a loved one, or maybe you're working with a caregiver, or maybe you're looking to get into how to potentially plan for that as well as our life progresses. We need different things. Also, June, just to recognize, June is Alzheimer's disease awareness and brain health awareness month. So this ties in nicely to that. But like I said, I'm not going to go too into detail into some of the very specific conditions, more of like an overview of what we're doing as far as brain health general is concerned. So as always, our housekeeping stuff, as I'm sure you heard when you were logging in, the session is recorded. As Matthew mentioned, you can use the chat box at any time. I'll try to stop and check out as the slides progress if I see anybody commenting in or giving feedback, but we do always leave a nice chunk of time at the end of the session. If there's anything that you want to ask, whether it's related to this or not, it's totally fine. I'll do my best to answer any questions that come up. As always, I am a dietitian, not your dietitian, so please make sure that you are following the very specific needs and individualized approaches that you and your own healthcare providers are working towards that for yourself. And please make sure you get clearance if you are starting or stopping any particular changes to whatever you're doing in your health and wellness regimen. So if we've never met before, hello, I'm Dina D'Alessandro. I am a registered dietitian. I've been doing this for now about 9 years, I think, which is exciting, but sort of weird in a way to see how long it's been and how far I've come. I'm also an adjunct lecturer of undergraduate and graduate nutrition studies, health sciences up at Lehman College in the Bronx, which I know some of my former students and colleagues are now working in some of your community centers. So hello if you're there. I'm also the campus nutritionist. So I work at the Student Health Center where I am able to meet with the student population and give nutrition counseling to any of the currently enrolled Lehman College students. I'm also the founder of what is known as the Dish with Dina virtual platform. So I do a lot of patient counseling and other things like this, corporate wellness events, etc. And I've trained in a ton of different things, as you can see on screen here. I do lifestyle prevention for diabetes. I work in different functions with health fairs, and I've also been very grateful to be included in some magazines as a spokesperson and to do some research as well. So I'll move on to what I like to share sometimes, especially, gosh, what did we do? 2 months ago, we did kidney. Next month, spoiler alert, we're going to do liver. So we're definitely going through a lot of the body systems and the organ systems throughout the body. So I just want to show on screen here, in case you do not know what your brain looks like, this is a drawing of it. So what you see in front of you here is the cerebrum. That is that part of the brain that encompasses the cerebral cortex. So on the left-hand side, it's color coded to the different sections of what the cerebral cortex includes. And of course, each one of these little parts does its own thing. So we're talking about what's responsible for language or motor function or other cognitive functions or understanding visual suggestions or stimulations of interpreting those things. Like I can see a stop sign, I can see a red light, I can see your face, things like that, playing a major part in hearing perception as well. And when you see the brain stem there, right, so this is also part of what's known as the central nervous system. So that brain stem relates the discussions of the talk of between the brain and the body of what's going on, and that also is responsible for things like our breathing functions, our heart rate, and other motor and sensory functions too. So when we talk about brain ailments, we're talking about a wide variety of things. I'm going to share with you in the coming slides a little bit of everything, but we're really talking about that it can impact a various bunch of functions too. So say something does happen, you have a concussion, you fall, or there's deterioration in a particular part of the brain, you might start noticing, or other people might start noticing things like slurred speech or memory loss, or the inability to, again, recognize maybe those visual cues, or maybe your hearing is a little bit impaired. That is all related to our brain health. So here we have one of three categories of what I'm going to share with you today. This is neurodegenerative disorders. These diseases involve the progressive deterioration of our brain cells and thereby the nerve function as well, which can lead to cognitive decline and motor impairments. Examples, like you see on screen here, things like Alzheimer's disease, Parkinson's disease, Huntington's disease, ALS, which is also known as Lou Gehrig disease, multiple sclerosis. If you know or find or follow some of the entertainment news out there and you know who Bruce Willis is an actor, celebrity who was most recently diagnosed with something known as ataxia. So that is something that is affecting his ability to do what he loves to do in his profession now. So with the progression, these disorders can affect pretty much every aspect of a person's life. When we're talking about things like mobility, balance, but things also like swallowing or bladder control, bowel function, and things like blood pressure fluctuations, sleep, mood, and speech. So, some of the treatments around this, whether it's reducing the risk of something if you are at risk for it, or it's managing a condition that you don't want it to progress any further, could be things like meeting with many healthcare providers like neurologists, physical therapists, speech pathologists, cardiologists, psychologists, dietitians, and social workers. Next up, we have cerebrovascular diseases. So, anytime you see the word vascular, that's always related to blood systems. And in this particular case, we're talking about the conditions that are related to or affect the blood flow to the brain that could potentially cause one of the more common issues like stroke, but other neurological problems as well. So, like aneurysms or malformations, too, can be part of this, too. In this case, treatments, preventative treatments or management treatments may include things like blood pressure, medications, blood thinners, which are technically known as anticoagulants, cholesterol lowering drugs, so things like statins, and also blood sugar medications as well. So if you're dealing with prediabetes, type 1 or type 2 diabetes, these are things that we're going to try to ask you to be sure you're staying on top of with your regimens there, whether it's the lifestyle factor changes or the medications like metformin or insulin. Because in the case of what we're talking about today related to cognitive health, and I've said this before, I think we've had some other conversations in past webinars where I've mentioned this. We're starting to see it's not technically an official term just yet. It's not a formally recognized diagnosis just yet, but we've come to see something like Alzheimer's disease, which is the form of dementia. It could be related to insulin resistance. So if you're having issues with blood sugar management or blood sugar stabilization, that is potentially going to cause issues with our brain health. And we may see this being termed as type 3 diabetes. So I think I might have mentioned that in one of the previous discussions we've had before. All right, next up, we have mental health disorders. So we have the physical and the mental capacities of all of what our body is doing. So conditions like depression, psychosis, those can also be categorized as brain ailments. And in this case, they are diagnosed more in the line of what is known as the DSM or the Manual of Mental Disorders. So, this is behavioral psychology therapy and those sort of things too. You have anxiety, depression, bipolar disorder. All of those can have effects on your food, your focus, your sleep habits, and also vice versa. If you're dealing with other issues that can affect your brain too. Eating disorders or disordered eating patterns would also be categorized within this section here. And those can be triggered by so many different things like social settings, negative self-talk, and some past traumas. I think we didn't go too far into detail with eating disorders specifically, but we had this mindful discussion way back about that negative self-talk. So again, things that affect our ability to make choices, whether we have an appetite or not, related to our mental health. So common neurodevelopmental disorders here in this category can be things like intellectual disabilities, autism spectrum disorder, attention deficit slash hyperactivity disorder. And understanding that these things can be so complex really does involve recognizing hopefully some early interventions or early signs, and then providing appropriate support. And as always, really promoting and normalizing some of the stigma that might be around things like mental health and promoting neurodiversity awareness too. So these conditions can be categorized by impairments in cognition, like understanding things, emotions, behaviors, and this is why like a lot of our conditions, we encourage a multidisciplinary approach because you might need a variety of different people to work with in order to manage that issue. All right, risk factors. So yeah, we're going to get into obviously the food and nutrition in a second, but I always like to show these things. A lot of times people will say it runs in my family, I'm predisposed genetically to something, but we have come to see that that's about maybe 20% of what the factors are that indicate our health outcomes. So if you do know your family history, that would be great to understand that. If you don't, there might be some blood tests or some other things that you could do to determine what you could be at risk for things if you want to look into that a little bit further. And number two here, there's also stuff that is completely out of control. Well, genetic predispositions out of our control too, but things that like, air pollution, noise levels. Okay, noise levels might be within our control if you're not able to hear things and you're turning up the volume and a lot of stuff, but also toxic exposure to chemicals like pollutants and pesticides too. That can be that we come to see that's a big correlation with some cognitive issues as well. And then, me, I always like to make sure I give a nod to and recognize the social determinants of health. So again, things that may or may not be within our control, like socioeconomic status, education, accessibility to quality, affordable, healthful, nutritious food, and healthcare. All of these things can play a role in our health outcomes and also specifically to our brain health too. Also, I just want to share too that understanding most of the research around brain stuff, which hopefully makes sense, is laboratory based. So animals are going to be what we're going to be doing the testing on. Humans are not lab animals. We have a wide range of factors and an ever-changing list of influences that we deal with on a day-to-day basis throughout our life cycles. So this is what makes it a little bit hard to mitigate so much of these scenarios. It can be quite challenging to recognize, prevention, screenings, or what to do because it's such an individualized discussion around that. All right, if you've been at these webinars before, I usually have a conversation that includes the gut discussion, the gut brain connection. This is a perfect opportunity since brain health is the topic of choice for this month. So, the gut microbiome or the gut microbiota, which is both good and not so good bacteria that live in the lower part of our gastrointestinal digestive system, they're in charge of a lot of stuff, my friends. That's the powerhouse and the factory that's helping us perform all these things. And if you remember from some of our past discussions, it's known as what's called the bidirectional communication. So we have that brain stem, that vagus nerve, that central nervous system. They chat with each other, right? It's like that little two-way phone that they got going on there. So if your gut is disrupted, you're dealing with GI issues, that can affect things like brain focus, or if your mental health or your brain health is disrupted, that can affect the way that you digest or metabolize food. And so I'm going to share with you here just about like how exactly that works. So the gut health influences brain health through the production of what is known as neurotransmitters. So think of something like a hormone like serotonin and the regulation of inflammation. We talked about inflammation before a few times. We actually had a whole webinar about inflammation a while back. When you're talking about things like chronic stress, it's good to be excited about something. I'm going to a wedding, or I'm happy about summer coming up, or I'm building a house and this is something exciting. That's one thing to be like having that fun, anxious nervousness about you. But if you're dealing with chronic stress or you're constantly in a state of anxiety or disruption of some sort, that can also lead to systemic inflammation, which means that our whole body is being affected to it by it, and thereby also so is your brain. So cognitive decline could be a risk at risk there as well. Depression, anxiety are also common in that sense too. If you're dealing with cognitive impairment or isolation or being unsure about how to engage or process certain things, that can make you feel kind of depressed as well. So this is why, like I said before, addressing mental health is very vital as part of the comprehensive brain care. Because just like when I talk about kind of like those pillars of health, if one falls down, they all fall down. Well, if one is strengthened, we sometimes do see a ripple effect, a positive ripple effect that also is good in the other factors as well. And that last bullet, we're going to talk a little bit about this in the coming slides of why it's so important to diversify your diet. Having a wide range of foods can help build up that gut protocol of the little micro bugs that are hanging out in there and doing all the fun things for you. So we'll talk a little bit about what that is in the coming slides. Here, just an overview of some of these key nutrients and foods that support our brain function. I mean, I'm sure this is no surprise of what you're seeing here, right? We talk about this almost every every time we meet. We have things like berries and leafy greens and whole grains, fibrous foods, healthy fats, omega 3s, fatty fish, etc. These are things that are going to help with stabilizing and managing our overall functions of health, but also reducing that inflammation and reducing that oxidative stress. If we remember the inflammation discussion, we talked about oxidation, whether it's sunburns or overuse of pharmaceuticals or that chronic stress going on. Those processes that happen can negatively affect us and are strongly linked to neurodegeneration. So one of the things I don't think I brought up, but again, this is not any surprise either, something called the mind diet. So we have in the nutrition world, we have some approaches that we can use as guidelines or recommendations, like diabetes or renal issues, that we follow these protocols. And in the case of reducing the risk of cognitive function, we have something called the mind diet. Play on words there, mind. It is a combination or a hybrid of the Mediterranean diet, which I'm sure we've all heard about before, and the thing called the DASH intervention. So DASH stands for Dietary Approaches to Stop Hypertension. Hypertension meaning high blood pressure, and what you saw before when I was explaining that cerebrovascular set of disorders, that's where that plays a role, right? Making sure we get that blood pressure modified or managed there. So what you see on screen here are kind of like the top 9 foods or food groups or ingredients that we encourage people to consistently include in their diet. I'm going to give some stipulations around this too. Number 1, green leafies. High on the list there, you have things like kale and spinach, whether they're cooked or raw, salads, whatever it is that you want to incorporate. We usually say try to aim for about 6 or more servings per week. So, just a handful of these green leafies in your diet, maybe once a day. Now, I put a little side note on here. If you are on anticoagulants, if you're on blood thinners, vitamin K is technically, it was given as a German name for that vitamin, standing for coagulation. So vitamin K helps our body clot. It helps us from bleeding out, whereas an anticoagulant medicine is going to help the blood flow a little bit thinner, right? In that sense. So you might have, if you've been put on these medicines, you might have been told, oh, you can't eat salad anymore, or you can't eat leafy greens anymore. And that's not true. The recommendation around that, the guidance around that, is really being consistent with your green leafies. So not having a ton one day and then none the next, a ton one day and none the next. It's more about just having, again, a simple serving every day, getting those really good properties, nutritional value in there, and then being able to also not have it interact with your medicine. Then number 2, yes, literally all other vegetables are invited to the table. Please do as much as you possibly can. Try it at least, one serving at least once a day, as often as you possibly can in your meals. Number 3 is interesting because fruit isn't necessarily on here as a whole, but berries are specifically. We do see that berries, we're talking about those, again, darkly colored things like blueberries and raspberries, and cherries I would probably put on this as well, because they have a little bit more of what's known as a higher antioxidant property than maybe some other fruits do. So if you're not a big fruit person, like I'm not somebody who wants fruit all the time, but I'll put something like frozen strawberries in my smoothies, or I'll add blueberries into my oatmeal or my cereal, and that's a way for me to get that in there too. We only recommend like twice a week for getting some sort of berry product into your systems or into your meal plan. Assuming you're not allergic, nuts is next on the list. Very high in good quality fats. It also keeps us a little fuller longer. And we do see, again, with that discussion around brain health, of, I didn't go into detail earlier, but we have something called these amyloid beta issues that go on with supporting our brain and the function of those neurons connecting with each other. And we do see things like healthy fats being able to help support that. So the Mind Diet creators don't necessarily specify what kind of nuts. So you like peanuts, you like walnuts, whatever it is you want to do, feel free to add them in. What did I say? 5 or more servings a week. So once a day, boop, boop, boop. Serving, okay, let's not crazy here. Serving is like a flat palm. So just a little scoop, a couple of maybe 150 to 200 calories worth of whatever your nut of choice is. And if you're doing a nut butter version instead, I would probably say maybe limit it to 2 tablespoons. That's about a serving size if you're doing it in a nut butter version. Next up, olive oil. right? The unsung hero of cooking methods. We always love olive oil instead of things like butter. Obviously, don't fry your foods if you can avoid doing that, or you can also dress your foods with extra virgin olive oil, so including that for healthy fats too. Whole grains, number six. I try to make sure I say this a lot too. We really recognize people's cultures play a role in a lot of the way that they eat. A lot of cultures across the globe, I would say probably all of them do, include some sort of grain-based food, whether it's rice or pasta. So not every meal that you have that has a whitened version of that grain or a non-whole grain version of that grain has to be whole grains, but we do try to encourage about 50% of your diet be focused on those whole grains instead. So we have things like brown rice, even quinoa. Quinoa is technically a whole grain, believe it or not. So is corn. Just a side note. Brown rice, whole wheat pasta, 100% whole wheat bread. So if you are doing things like toast or sandwiches, opt out for something that is a whole grain version, maybe half of the time that you're doing that. Three servings a week of some whole grain. I tend to say maybe, once a day if you're big on having some more grain-based foods. Again, fish, not everybody's a fish lover, but if you do eat fish, we do encourage you to eat the more beneficial fish, like the fatty fish, like salmon and tuna. Sardines are on this list as well. So is trout. Usually between 1 to 3 times a week, we would say put this into your meal plan, because then we enter into that discussion around potential higher levels of mercury that can be associated with fish. But this also helps us with those omega-3 fatty acids. Number eight is beans. Beans, they're good for their heart. You know the rest of that story. I don't mind. I don't mind the gassiness and I don't mind the bloating. I love my beans, but if you don't like them, you can do a couple of things about that. You can either, if you're purchasing the beans in dry form or in a canned version, you can soak them and kind of get some of that natural salt or added salt out of there, or you could take a little enzyme that reduces the bloating or the gassiness feeling. So this category includes all types of beans: red, kidney, pinto, black, whatever. Lentils are included in here. So are soybeans. So that is where a tofu can come into place as well. That can be part of your diet at least 4 times a week. You can include some of this. That'd be great. Number nine is poultry. So again, this is a lean protein. We'll talk a little bit in the second slide as to some of the things that we're going to limit, but this is chicken or turkey. Obviously not a fried chicken or a fried turkey. Things like ground versions of this you can make into chili, etc. All right, let me move on to the things that we would prefer that you limit or decrease or avoid according to the Mind diet. I have some things to say about number one and number two. So butter or margarine, because there are saturated fat, but also some highly processed food involved in there too. Try to eat less than 1 tablespoon per day. Instead, utilize the olive oil instead. And cheese, the Mind diet is not big on dairy products for some reason. So they say eating cheese less than once a week. Let me tell you something, okay? You know how I talk about this all the time. Last name like D'Alessandro, I'm contractually obligated to eat my pasta and eat my cheese. But I will say, I understand this. Cheeses in general can be a little high in saturated fat. Softer cheeses, harder cheeses can be a little high in sodium, so that will be related to the high blood pressure discussion. So I understand with being a little bit more conscientious about cheese intake. So it doesn't mean it's completely off your diet, just being mindful about how much. Red meat, we see a lot of correlations with red meat diets with higher issues around cholesterol or colorectal cancer. And in the case of brain function as well, it can be correlated with increasing the risk of some brain cognition issues. But what I'm reading here for the Mind diet, it says no more than 3 servings per week. So you can include things like beef or pork or lamb or other products like that. Again, how you're grilling it or broiling it or serving it up versus a fried version of it. Just be mindful of that. And leaner type more than the fatty type, obviously. The last two, no, again, no surprises there. Some of these, what are known as like these more highly or ultra processed foods, are to be limited or to avoid as well, because these can definitely increase as well. This one says limit your consumption to less than once per week as far as fried foods. So you can still have fried chicken or fried French fries if you want to, and not feel like completely void of those items. I just want to do a quick little side note. I think I have time to go off on a tangent for a second. My criticism sometimes of the Mediterranean diet, it's utilized a lot as like the gold standard. It's very highly researched, and I feel like it's implemented quite often as like a one size fits all approach. Your doctors might have even said to you to follow this diet. However, from the name, you can understand it's predominantly based around European cuisine. So, we've talked in the past webinars about really being culturally sensitive and understanding that there's diverse dietary practices across the globe. So it doesn't mean you should vilify or make it sound like your diet is not right, but there could be some modifications. And I think we could agree that the items that I listed on that slide before can be implemented in a lot of people's cuisines, or healthifying whatever the practices are that you're doing now, whether it's portion or its cooking method. All right, next up, so let's do some show and tell. I like meal ideas, right? You can kind of take what I've just said and implement it in different ways of doing something like this. So something here, I'm going to share with you some simple meal ideas, not necessarily recipes, but it's pretty easy to kind of see what's involved in this stuff. So something like this chickpea bowl has heart healthy foods, brain healthy foods. You got the olive oil in there. We just talked about the beans family as well. You have mixed greens too. These are foods that are naturally plant-based proteins. There's fiber in there, phytochemicals in there. Those are those naturally occurring compounds that help with supporting our cell health and protecting us from diseases and damage as well. And something like this, by the way, not only is it easy to make, I think, but it can really satisfy anybody who might be following a vegan/vegetarian or even a gluten-free or a dairy-free or even a nut-free diet. So a lot of diversity here that can be applicable to different preferences and diet preferences. This photo here, we see something known as the oven baked salmon that you can serve with a side of turmeric, cauliflower, and wild rice. So again, turmeric is an anti-inflammatory. You might have remembered that from our inflammation discussion. And you can add that. You don't have to take it in a pill. You can add it as a seasoning to some of the things that you're making. So the ingredients here contain things like omega-3s, which are your healthy fatty acids. You have anti-inflammatory support here as well. You have some spices, which are really great, and fiber too goes a long way with anybody. And if you're following a pescatarian diet, gluten-free diet, and or dairy-free diet, you have some options like this too. Next up, we have a hearty dish. I chose a picture of a coconut lentil curry with spinach and sweet potato. I don't think you can see the spinach there because that's just a little either cilantro or parsley dressing on the top there. But this contains, again, nutritious plant protein sources, iron, B vitamins, anti-inflammatory ingredients, and is good for anyone following a vegan, gluten-free, or nut-free diet. Coconut, by the way, is not a nut. It's a fruit, just a side note. Then, if you feel like jazzing it up a little bit, I actually think there's shrimp in here if I can see, but I probably would put like maybe a fish or a chicken in here if you wanted to add a little bit extra protein to it, or you prefer to have some animal products instead of just plant-based foods. And then lastly, something like this blueberry walnut overnight oats for your morning meal. You can set this up at night and stick it in the fridge in a container and let that kind of gel up in there. That contains oats and chia seeds, blueberries. Again, we have the berry portion of that. Walnuts, which benefit your brain health. They have antioxidants, omega-3s, all the fun things. If you have a nut allergy, you can substitute, assuming you don't have a seed allergy, you can substitute sunflower seeds instead. Okay, next up we have physical activity because we always include a variety of different factors and health supportive benefits, but I want to always disclaim, making sure you're cleared by your doctor for movement. So physical activity has been proven or shown to be one of the most effective ways to support our brain function and to reduce the risk of things like neurodegenerative diseases. Exercise helps with improving the oxygen flow, that blood flow going to the brain, and it enhances something called neuroplasticity, which I'm going to explain in a second. It also promotes these proteins in our brains that help with supporting the survival of those neurons, the cells that we need in our brains to function. On the right-hand side, the dietary guidelines for Americans is what I usually share with you of what is implemented. So I just shared the Mind diet, and that's based on some of the guidelines as well. But here we have the physical activity guidelines, at least 150 minutes of moderate intensity aerobic activity. So that's something like walking quickly or doing gardening. Those things all are part of moderate. If you're doing more vigorous things, like maybe you're swimming or you're walking quickly on a treadmill, that would be more vigorous intensity. So you don't need as many minutes of that if you don't want to. And then we've talked to in the past about muscle mass and the deterioration of that as we age. By nature, we encourage people to include weight-bearing exercises, whether you're lifting weights or you're working with resistance bands or you're just doing body weight exercises that you can kind of like focus and support on your core health. That can help with managing your muscle mass as well. We usually recommend 2 or more days a week there. So the rule is really don't be sedentary, right? Being too inactive is what can negatively affect our physical, our brain, and our overall mental health as well. A quick side note here that I just want to acknowledge, if you have mobility limitations or physical issues that you're either it's an injury, short term, or it's a long term issue, you have other places to go with this. You have other things that you can move more gently. You can work with your doctor, your physical therapist, your occupational therapist to make sure, again, that blood is flowing. That's what's most important, is to get that blood and oxygen flowing. All right, I think we've talked also too about sleep and stress in the past as well, and I'm going to reiterate that here. Sleep and stress tend to be often overlooked. We focus so much on food, nutrition, and exercise, but they also play a very significant role in so many of our body functions, and brain health is included in that. Poor sleep. So the way that I think of this, quantity and quality, right? We're looking at sleep hygiene, what we call this. Poor sleep can disrupt the clearance of toxins in the brains, that the whole amyloid beta thing that I just mentioned, and can put us at higher risk for things like Alzheimer's disease or neurodegenerative disorders. So I think of this like, I might have said this before in one of the past webinars, like you have a house cleaning crew. Lights go off and they're there scrubbing and washing and sweeping, and they're doing all the things that they need to do to remove those toxins from our brains. But if you're constantly being interrupted, if you're tossing and turning, if you're only getting a few hours and not the recommended 7 to 9 a night, it's almost like we flick the light switch on and they all go scattering. Your whole house cleaning crew grabs their stuff and they're like, we're out of here. They got to go. So it doesn't give them enough time to thoroughly get rid of what's building up in our brain. And then, of course, that puts us at risk. Chronic stress, too, this keeps coming up. I just said it earlier as well. That can exacerbate inflammation. That can, in turn, affect and impair our cognitive function. So improving or putting a plan together for some of these things with your sleep hygiene, your environment, whether it's the physical noise or the light around you when you're going to bed, any habits, you can go back and take a look at some of the stuff we've recorded before about mindful exercises and techniques and breathing and all of those things that can support in creating a plan. I'll ask now if anybody wants to put in the chat, and Matthew, you too, we might have talked about this in past webinars. What do you have a bedtime routine? And if so, what is it? Like, what do people do? So you can, if anybody wants to share on behalf of where you're watching or put in the chat, what are some things that you do for your bedtime routine? What does it entail? If you don't mind sharing, you can put it in the chat. And Matthew, do you want to open up your mic and share with me right now? Do you have a bedtime routine? Like, are you regimented?
Putting me on the spot. Well,
The answer could be no. That's legit. It's
no,
okay.
I mean, I kind of have a routine. When I get into bed, I open a book and read until I fall asleep.
Mm-hmm. Okay, so that alone will lull you. That
Yeah,
alone will lull you. So from
especially with what I read.
with it's not that exciting. It doesn't keep you awake. That's
Sometimes not.
funny. But that actually goes to a point that I want to say too. My routine, so I have like farmer's hours, right? Like I get up quite early in the morning. I go to bed quote unquote early compared to a lot of my colleagues and my interns and such. I usually have an alarm that I set. I set an alarm around 8 o'clock, and that indicates like, okay, that's like a 2 hour countdown. Like you have from this point to start winding down. So if I'm in the middle of something or I've had a long day of work, I'll wind down with, some last things on my computer. I will definitely physically enter into my sleep time mode. So that's an indication of me. All right, start putting your jammies on, go brush your teeth, go wash your face, maybe start turning the lights off around things, just making it a little bit quieter. Screens, by 9:30, screens are off. Like if I'm incessantly scrolling on social media, that's bad for my eyes and that gets me stimulated. So I just want to hush that noise, that visual noise down. I might put a television show on, I might read a book. So there, and I think I mentioned this before too. I have a super sexy sleep mask and headset that goes on me. So like there's blackout everything, noise canceling everything. I'm in my own little cocoon, which I love so very much. And that does work. I've had issues in the past with insomnia, like big time insomnia, like 3 hours a night for many weeks in a row. That is very bad. Let me take a look in the chat. Oh, okay. So Bruce says, am I familiar with the app called Yuka? I might be familiar. Bruce, do you want to share with us about that? Like, is it a sleep timer app or something that is like a meditation thing? If you want to add a little bit more to what you shared in
Um,
here.
can you hear me?
Yes, yes.
I read about it in the New York Times this week. and I downloaded it into my phone, and what it does, it has a scanner.
Mm.
So if you have a product, you scan the barcode.
Oh, yeah.
And,
Okay.
I was wondering if you were familiar with it.
Yes, yes, yes. Yeah, well, if you don't mind, we'll talk about that at after I wrap up, and we'll
Oh,
talk a little bit more about that because that's a food thing you're talking about,
yeah.
not necessarily related to sleep, but it does help with understanding the ingredients of something or kind of like the healthiness of a food so you can make good recommendations or good choices for yourself. Yeah, I love anything. I'm going to talk a little bit more about stuff like that in a second. So thank you for sharing that. Thank you for
Hey,
sharing
thank
that.
you, thank you.
Appreciate that. Thank you. Yeah, so putting things in order, things like that you think could help with that. Oh, Bruce, do you want to mute yourself? There you go. Thank you, my dear. Putting things in order for yourself, just recognizing where there might be areas of improvement, and we'll talk a little bit more about that too in the coming slides. Give me one sec. I just lost my place there. Let me switch over to slides. All right, let me define for you what neuroplasticity is. If you've never heard of this before, it's basically just a fancy way of saying our brain can recover from things sometimes, depends on the extremity of the damage that is done or how long there's been damage done, but there is a way for it to adapt and change and repair itself and maybe even replace damaged cells. So it could be functional or structural, as you see here. There could be functional or structural changes, like function of what we're doing, or and also literally repairing of the damage of the cells itself. So allowing the understanding of neuroplasticity, and I'll share with you in a second of some of the things that can support that, can help with promoting things like the ability to learn new things, like languages or tasks or skills, the ability to enhance existing cognitive capabilities. So maybe you're at level 1 with something, you want to go to level 2 with something. It can also help, which we've seen before, again, depending on the severity, with recovery from some things like stroke or traumatic brain injury or accidents that happen that affect the brain. You might see somebody regain their speech. It might take a while, but you can see somebody with their motor skills again, or they're able to remember things again. It can also strengthen areas where function has been lost or is declining. Okay, so I've said before, and I'm sure all of you right now too, maybe I'm stereotyping in a way, but it's possible you've walked into your room and you're like, what am I doing here? What was I supposed to do? I forget. Like I often get nervous with stuff like that because I'm thinking, is it menopause brain? Is it early onset dementia? Or am I just, is it just like a memory? Like I just forgot. I'm focused on something else. I'm not paying attention. But you don't have to be scared of things like that necessarily to know that there are ways that you can support that or strengthen and boost your brain fitness. So here on this slide, I'm going to share with you a bunch of things that we can do. Hopefully, every day implement or every week try to implement some form of this. I'm just checking the time. I think I'm okay on this. Keeping the brain active, wide range, engaging activities that stimulate what the brain is doing. So these activities can range from playing games, learning new skills, everything can help benefit us, memory focus. So again, think of your own limitations or things that you might want to support and where you might feel the need to include some other things into your daily habits or your weekly habits. So meditation, yes, visualizing. Visualizing is a huge thing I do. We're literally just walk through the steps of something. I'm going to go to this place. I'm going to take out this library book. I'm going to walk home, like walking through the steps of my day. That's how I visualize things. Or I visualize, oh, I can't wait to go to the beach. When I get to the beach, I'm going to do this. I'm going to put my chair down. Walking through the steps of things that can also be part of brain activity. I won't read through all these things because you could take a look through all this, but learning new skills or learning new music or, or engaging in something that you haven't done before. Physical activity we mentioned too, exercises like dance or sports or Tai Chi, whether it's low and slow or quick pace, whatever it is, again, right? It's movement, it's being able to recognize placement of your body and the control that you may or may not have and strengthening that ability. And then even things like socializing, sometimes as we age, we get more isolated in things. Places like this where we're doing so many virtual activities can feel kind of sad to this is how I'm living. I'm just living on the other side of a computer. So try to engage in socializing. It could be even just asking questions about somebody, or like I mentioned before, maybe ask somebody something interesting about themselves and keep repeating that over and over again. Oh, right. You told me you like baseball. What kind of baseball teams are you a fan of? When's the last time you went to a baseball game? And see if you can retain that information, whether you're learning interesting facts about them. I want to point out here too, video games sometimes get a bad rap of like, stop being on your computer all the time. But depending on the video game, that can teach you strategy and critical thinking skills too. So where are you moving? What are you doing? How are you advancing? So a lot of these video games aren't always a bad thing. All right, next, what you see in front of you, you may or may not have seen this before. This is what's known as the Stroop test, Stroop, Stroop test. This tests our delay in reaction times. So you can see here that there's a mismatch, right, between the word for a color and the font color in which it is printed. Now, assuming that you don't have color blindedness, you can recognize what you're seeing here. So for instance, blue is the word blue, but it's written in red. Green is the word green, but it's written in purple. So take a look at this for a second, and whether you say it to yourself or out loud, if you're sitting in one of the centers there, see how long it might take you to realize, oh, right, that's the color that's in. And again, hopefully, if you're not dealing with color blindness where this might not have any effect on you, but for those of us who can see and distinguish, it takes a little bit of a minute to kind of go, oh, okay, yeah, right, that's interesting. So little things like this too, kind of part of those brain activities to keep your mind active and engaged. So some other things to keep in mind, I always like to encourage people early detection. It's never too late to start or stop something. So the more you understand about yourself, the better. The more information you have about yourself, the better prepared you can be in what the advances of that might be or how you can manage it. So we have things like medical evaluations, cognitive tests. I bring up my mom all the time on these discussions. She has through her insurance, she has an evaluator come to her home about every 6 to 12 months or so, and they'll do things like cognitive tests on her. They'll say, we're going to spend 20 minutes together, and I'm going to say 3 things to you now, and in 20 minutes I want you to repeat them back to me. And it's like, Mr. Smith, Main Street, the number 13. Okay, I want you to remember those. You can't write them down. Remember those, and in 20 minutes I'm going to ask you to repeat them back. Sometimes she remembers them, sometimes she does not. Doesn't necessarily indicate a sign of dementia. It's just information to kind of keep in track to see if it progresses or if it gets worse over time. Additional assessments can be things to kind of rule in or rule out. So if you are nervous about something or I should say genetically predisposed to something, you might want to ask for an MRI or a CT scan. This way you know what you're dealing with. And then symptoms and history. I am such a huge fan of people bringing notebooks or keeping notes of things, not in the sense of like you have to weigh and measure your food, every morsel that you eat, but more about what are things that you're feeling? What are the triggers that are happening? Are you noticing patterns with anything? Like I'm noticing I'm getting a little bit confused with stuff, or I'm noticing when I eat something, it makes my stomach feel weird. Maybe that's some information that you can bring with you to your doctor's appointments and that you can just collect as history for yourself as well. I talked about the comprehensive approach, the more the merrier in our healthcare team, assuming hopefully that we can afford that, whether it's time and money and energy of going to see people that we need to see. Obviously, as we age, we sometimes do end up collecting quite a team around us, cardiologists, nephrologists, gut health people, mental health people, etc. It's not written down here, but I don't have to tell you this already, right? Lifestyle habits, keeping in mind, no pun intended. Stop smoking. One of the hardest things I've ever done. I've said it before. I'll say it again. If you can, please do so. Stop smoking if you're smoking. Preventing or managing high blood pressure, managing your cholesterol levels, right? That whole discussion around heart health and brain health and vascular issues, being socially active, engaging in things that keep you stimulated, and managing blood sugar levels. I don't know if I said that already, right? Because we said before there might be some insulin resistance correlation to brain health. So if you are dealing with diabetes, making sure you're taking your metformin, you're checking your finger sticks, you're taking your insulin, and you're eating appropriately. But as we've seen in many of the webinars before and today too, stress and sleep also play a huge role with hormone disruptions and blood sugar levels too. So it's not just about not eating carbs anymore to manage your blood sugar. Last but not least, of course, I've said this before as well. Nobody likes when I say, please reduce or completely avoid alcohol consumption. We've seen so much research. It is technically a class 1 carcinogen, meaning it does cause cancer. How much of too much of anything, we don't know just yet. If you've never drunk, don't drink alcohol. If you are drinking alcohol, please consider significantly decreasing or stopping altogether. A little easier than done. I see a chat. Give me 1 second. Actually, I think I can go in there right now before I go to the next slide. Let's see what the chat says. Oh, good. Okay. Thank you, Bruce, for chiming in with that. Thank you. Yeah, sometimes that's part of your regular assessment where you get those cognitive tests, and sometimes you have to ask for them if you feel like there might be something that you're concerned about. So thank you for sharing that. All right. So let's talk about caregiving, right? For me, I work with my mom. I oversee her. I'm not a daily home health aide. I go down every so often, but I do go with her to her doctor's offices. Maybe you are currently receiving care from someone, or you are getting prepared to have someone in your life that you know of that can help support you as you continue moving through your age, your stages, or whatever conditions you're dealing with, however we define this. So it's that mutually beneficial relationship that we have with each other. And caregivers can go through a lot of stress and strife as well. So in the case of somebody with a cognitive decline, I'm not going too far into detail with this slide, but there could be issues around food and texture modifications, like something might need to be pureed, or they can't chew or swallow anything too crunchy. So being conscientious of some food changes that might come with it, but also dignity around that too. So we don't want you ending up having, just a bunch of slop in a dish and being like, just eat something for the sake of eating. We want it to be visually interesting. Again, we want to be sensitive and respectful to people's cultures. And also setting up a structure could be really useful too, both for a patient and their caregiver. So when you have structure, especially as we age, we know sometimes we lose different kinds of senses and different abilities to recognize our appetite cues, like when we're hungry, when we're full. So it helps if we set a time of I eat this time regularly throughout the day. Again, that keeps us consistent. And if you are a caregiver or work with a caregiver, that can also give them a chance to either eat on their own or maybe run an errand or take some self-care time for themselves. In the next slide, I'm going to share a little bit more about some of the support around that too. And of course, the last slide is the brain stimulating activities that we just talked about, not just for ourselves, but also if we're working with caregivers too, that it's never too late to start any of that stuff to get ourselves engaged. So I found a few, this isn't completely comprehensive, but this is a list of examples of some resources online. So we have the Institute for Neurodegenerative Disorders. We have, that's specifically for the brain conditions, stroke.org, so that's heart health, but also brain health too. Mental health, that's something that I'm a very big advocate for as well. We never know what the extremities are of when people are going through, so just making sure that they have support and understanding that there is such a correlation between physical and mental health. Caregiver Action Network, that I love too. So, and this is also maybe available to you in other more local things like what we're doing here in New York City, but in a general sense online, you can find things that support, give resources, or if you are a provider, you could also look at some toolkits or some strategies or some webinars or some blog posts that can help strengthen your own services of what you're doing. Bottom right is the Brain Injury Association. So again, recovery from things like the traumatic brain issues or concussions or things like that, if you know anybody who's dealing with that. So I just thought I would share some of those that are available out there for us, and there's so many more about that. Just know that you're never alone, that there's always something that can help with supporting whatever care you are providing for yourself or for others, and hopefully reducing the risk of anything else going forward. As I always do at the end of these webinars, I always ask you to, think about what the takeaways are. What are some things that I shared with you here today that you might want to start implementing, whether it's going for some cognitive tests or it's adding leafy greens to your diet? Are there things you're already feeling pretty good about that you feel validated from this discussion that you want to keep on doing and making that a regular part of your routine and your life? Or are there things you want to stop doing that might no longer serve you? Like maybe, the fried food discussion. Okay, maybe I might want to start limiting that and opt for something that's broiled or grilled and just only do the fried food once a week or so. So those are our next steps, small, sustainable steps leading to larger, significant outcomes in the long term.